My name is Dr. Garzali Ibrahim Umar. I'm a consultant general surgeon with special interest in hepatobiliary surgery and liver transplantation. I've been in Aminu Kano Teaching Hospital now for 7 years. I've been a general surgeon for 5 of those years, and during the practice, I actually went for additional training in hepatobiliary surgery and liver transplantation in the Liver Transplant Institute of İnönü University, Malatya in Turkey. And currently we are working on a commencing liver transplantation in Aminu Kano Teaching Hospital. The liver is a very important organ in the body. It's second to only brain and the heart in the life of the individual because it plays a significant protective role by protecting us from germs we ingest. Once we ingest this germ through our gut, they'll go through the liver and they'll be killed in the liver, thereby protecting us. It also plays a role by taking the food we ingest and using it to produce ingredients that are important in day-to-day activity. So with that being considered, the liver is one of the essential organs for the body, and without the liver, survival is minimal. Now, the liver is mainly afflicted by inflammatory diseases in our setting. The commonest cause of liver disease in our setting is hepatitis B virus. And hepatitis B virus usually causes significant long-term inflammation of the liver that can even progress to liver failure, which will necessitate transplantation. We also have a number of liver cancers that may warrant liver surgery or even progress to liver transplantation. Yes, we have a significant number of liver disease in Kano and Nigeria as a whole because Aminu Kano Teaching Hospital serves as a referral for most northwestern states and even some northeastern states. So every week, we see at least 5 patients with liver disease that require liver transplantation right now, and we see additional 5 that will require liver transplantation in the near future. So at least 10 patients will benefit from liver transplantation for every week of our clinic. So it's something that is very important and required in our setting. Aminu Kano Teaching Hospital is doing very well and making a significant effort in commencing liver transplantation. However, one of the limitations we currently face is inadequate human and material resources. Now, we have a liver transplant surgeon that went and spent 1 year in Turkey in the person of myself. However, we are currently in the process of sending another surgeon to go and spend 1 year in Hungary, hopefully to acquire additional skills. Now, once we do, we're also in the process of sending a hepatologist, a physician that will go and learn about liver diseases and that require transplantation. There are also physicians that are responsible for making these patients sleep during the surgery. We call them anesthetists. And we are also lacking quite a few anesthetists that are specialists in liver transplantation. We are currently in the process of trying to send them to go and actually specialize in that area. So as it is now, we do not have enough manpower to commence liver transplantation, but we are giving ourselves 6 months to 1 year. We will acquire this. And we are using this opportunity to call on the stakeholders, the management, the federal government of Nigeria, the Kano state government, and governors of northern states of this nation to step up and assist the management in its significant effort to ensure that liver transplantation is available in our setting. One of the main things that is required is the machinery. There is what we call CUSA, that's the cavitron ultrasonic aspirator. It is not available. There is no single center in Nigeria that has it right now. And Aminu Kano is making effort to acquire it. And it is not possible for Aminu Kano Teaching Hospital on its own to acquire this thing without the assistance of the federal and state government and other stakeholders in the nation. Another instrument that we currently require, and Aminu Kano has acquired one, we need to acquire additional one, is what we call Thompson's retractor. In Nigeria, Aminu Kano Teaching Hospital is the first government hospital to acquire Thompson retractor. There is one in Lagos, but it's a private hospital. So we are the first government hospital to acquire it. For us to commence liver transplantation, we need to acquire additional one. And we're also calling on all the necessary stakeholders to assist us in ensuring provision of the necessary equipment. Thank you. Liver transplantation is an expensive procedure. As it is now, it will not be affordable for an average citizen, but there are measures placed on ground to ensure access by the average citizen. One of these measures is discussion with the National Health Insurance Fund to ensure that liver transplantation as a procedure is covered under the National Health Insurance Fund. And once we succeed in doing that, that means all patients that require liver transplantation will be covered by the National Health Insurance Fund. Another thing is engaging international collaborators. Like as it is now, we have engaged Muslim World League, and we are